we are all doing great. I'll be taking us through a series of topics on mental health. Kindly stay tuned. So, we will be talking about mental health. I'll be specific on suicide as a mental health condition. So stay tuned and learn. So today we want to talk about mental health. We will be defining what mental health is. We'll be talking about suicide and even risk factors. So let's begin. What is mental health? Mental health can be defined according to World Health Organization as a set of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, and work well. Mental health conditions include a mental disorder, psychosocial disability, acute emotional distress, and hopelessness, which are very common nowadays, and such problems may lead to suicide or self-harm. So now let's look at suicide and understand what is suicide. So suicide can be defined as an act of deliberately killing oneself. This can be done through poisoning. It can also be done through overdose. One can also do this through maybe hanging themselves on a rope. There are quite a number of ways of which people have committed suicide. So let's look at what are the risk factors that causes suicide. So one is a mental disorder, especially depression. This can be caused by loss of job, loss of source of income, or loss of money through conmen or through gambling, or even loss of a loved one. We've seen people who are very at higher risk of engaging in suicide activities because they have lost the meaning of being alive since the departure of a loved one or the passing of a loved one. So that can expose someone to suicide. We have other neurological disorders that can cause someone maybe to partake suicide. Then we can also talk about cancer and diseases, including HIV, as a factor that might be a risk factor for suicide. So according to WHO, every year almost 1 million people globally die from suicide, and 86% are in low and middle income countries like in Africa. So suicide is among the 3 leading causes of death for young people under 25 years and account for about 10 to 20% of deaths in women up to 1 year after giving birth. When one has depleted their ability to cope with a stressing matter, they may develop a suicidal thought. It's very, very common for someone to hear, for you to hear people say that, may the earth open and swallow me. They may also develop an intention on how to execute a suicidal thought. Then lastly, they may attempt to implement the suicidal plan. So these are things which normally happens. The most important thing is to for anyone who might be going through having mental health issues, to visit the facility, the healthcare facility where they can be supported. So in most instances, healthcare workers may fear talking about suicide, that it may provoke an attempt. This may not be true, and on the contrary, talking about suicide often reduces the person's anxiety around suicidal thoughts and help the person to feel understood, to open the opportunities for discussion of the problem that they may be having. So some of the typical presenting complaints of a person at risk of suicide or self-harm may be feeling of extremely upset or distressed, profound hopelessness, or sadness, past attempt of self-harm. So if this person might have tried that in the past, they are likely to go that direction. Thanks, and a lot is still coming. Stay tuned.